Parivar International hosts Postpartum Depression Session by Dr. Binu Chacko, psychiatrist practicing in New York.
To start off, we'll talk about postpartum depression. And the symptoms of depression after childbirth can vary, right? And they can range from mild to severe. And we've um, kind of heard about baby blues, and also, many women have experienced the baby blues. And sometimes that also is mistaken for postpartum depression sometimes. So we really have to kind of understand it. So when we evaluate, we do kind of ask all the general questions and kind of see if it really meets criteria for postpartum depression before we suggest a medication. Otherwise, there are other ways to kind of help people through their baby blues. So some of the symptoms of baby blue, which last only for a few days to a week, or a week or two after the baby's born, and they may include mood swings, anxiety, sadness, irritability, feeling overwhelmed, feeling like they can't concentrate. There's poor appetite and trouble sleeping. And obviously, if they are feeling sad and overwhelmed, they may be crying. So all those kind of are some of the basic symptoms. And obviously, the body has gone through a stressful, delivery. So there are various reasons for some of these things, and a lot of hormonal changes are happening as well around that time. And the I guess women may know this more than me, but I've heard different things. It's sort of like they also lost a part of themselves that was inside them, that they carried and they nurtured. And now that baby is outside, and then there's this pressure to like take care of that baby versus the baby that was easier to take care of, which was inside the body. So the overwhelming feeling is sometimes about, what do I do, with the baby that's outside me versus inside me, that was easier. I just had to take care of me. So all those kind of things, people describe, and until they kind of figure things out, and, so it is a hard transition. So postpartum depression symptoms, we'll kind of look at this. So depressed mood or severe mood swings. Usually this depressed mood is lasting longer than a week to 2 weeks. So we do kind of look for that particular criteria. And crying is basically crying too much, where people feel like it's not just like, oh, you thought of something and you cried here and there, but this is like crying like way too much, and people will start to notice. And during those times, obviously they are unable to kind of bond with the baby, and they may not be with the baby, they may be neglecting the baby. They'll withdraw from family, friends, they don't want the visits from people, they may be kind of feeling strange because their body looks very different now. They don't look like how they used to before they, had the child. And during pregnancy also, they may have liked the way they looked because they were pregnant and such, but then suddenly, after the baby's out, they don't like the appearance. So they have feelings toward themselves. And there is definitely a loss of appetite sometimes, or eating much more than usual. Sometimes they may be emotionally eating to kind of overcome these kind of dilemmas that they have. Then the insomnia is also part of it, or sleeping too much and wanting to avoid, like, doing what needs to be done. And meaning baby may be crying and they need to get up and feed, but they are just feeling a little bit too tired and not really ready for this, and kind of getting into a more depressed state, and unable to get up even if they wanted to at times. And then the extreme of like not sleeping also is there, and that could be more problematic. That could lead to even further worsening of symptoms, which we'll get to in the next slide. But overwhelming tiredness or loss of energy, it's obviously they went through a stressful period of giving birth, sometimes going through labor for hours. That can be very tiring, and all their adrenaline is gone. That also kind of feels like they're like all the air is out of the balloon kind of feeling, right? And there's less interest and pleasure in activities that they used to enjoy. Obviously they have more things on their mind, but definitely, it's part of a depressive symptom to kind of have no pleasure in anything that used to be fun before. And then there may be intense irritability or anger that they have, as we describe mood swings. It's kind of part of that. Um, so sometimes they'll be down and sad, and then the other few minutes or maybe certain triggers are there. A husband walks into the room, or somebody asks something about, what's going on, did the baby cry, anything, and they could take it personal and get really irritable and angry over those kind of things. Then there's, other things that naturally can be felt by everybody, fear that they're not a good mother, like they didn't have a specific training or something, is some of the thoughts that people have described. So they can start to feel a little hopeless as well, because they feel, kind of inadequate, or, unable to really step up to the plate and things like that. And sometimes it's because of not having people kind of guiding them, or they themselves not preparing themselves for the, post-delivery time by reading books and things like that. So, Americans usually go for the books, but then in our community, a lot of times, the parents are now taking care of the, um, you know, um, care of the mother after the birth also, not just the child. So, like, for example, my wife, stayed with her mom for a month while, she was recovering after birth and all that. And the baby kind of grew up in their house that first month, and I was just kind of, always there visiting and things like that while trying to, work and things. So, people do it differently in different cultures. But that kind of, nurturing is needed from somebody who can kind of train them, to kind of teach them what to expect or what to do as a, mother. And when grandma is taking care of the baby, grandma will do things in a trained manner, maybe, right? And do, oh, this worked, that worked. So they may be doing it like that. And mothers are also kind of learning from that. And sometimes mothers are, well educated. They are nurses. They have, worked in or been around others, so they themselves are fine, without the help of, their own mom or somebody else to kind of help them. Anyway, moving on, their feelings of worthlessness, shame, guilt, or inadequacy, we kind of hinted at. But the reduced ability to think clearly is also something that's very common. A lot of times it's because of how the blood is kind of draining. When they're pushing the baby out, the blood is kind of also, post-delivery, they're losing some blood. And while that blood loss is happening, our brain has this particular structure in the brain that can be starved, for a little while of blood supply. And that particular part of the brain, if it's kind of, starving for blood for too long, or starving for nutrition for too long, or lacking oxygen for a while for too long, it can also, produce certain symptoms afterwards. Sometimes it may be just, producing symptoms related to their metabolism, versus it could be related to mood and different things. So um, it's a syndrome, basically, that, happens during delivery in certain, females and such. So that's why it's very important that the delivery goes smooth and everything, is well taken care of in a timely manner, very quickly, without too much blood loss and all that. So moving along, obviously restlessness, severe anxiety, and panic attacks can be part of the, symptomology that we see. Thoughts of harming themselves, or the baby it can be a feature as well, because they just don't know what to do, and they feel like, oh my God, what am I going to do? I can't survive like this, or, I can't be responsible for the baby and take care of this baby. They may feel like, the only way out is like, to hurt themselves and the baby, or one or the other. So those are kind of serious symptoms when it comes to, postpartum depression that we worry about. And sometimes those symptoms, they can kind of, fight it off for a certain time, but sometimes it becomes overwhelming. And as you know, of cases, in America, where women have killed their their child, the newborn, or and even other kids that they have in the household, just because they are overwhelmed. Anyway, then the recurring thoughts of death or suicide, and those are also one of the symptoms that we look for. So postpartum psychosis is the more severe symptom that we worry about more, where we would want to kind of stabilize the mom in a psychiatric center before we discharge her home. And so sometimes the baby's taken home with through the father, sent home, and if there's enough caretakers and all that, right? And the mom has to stay back and maybe hospitalized until she's stabilized. Especially if there's I guess enough information from the mom that she's having those recurrent thoughts of suicide, or wanting to harm the baby, or experiencing like postpartum psychosis, which is a rare condition that usually develops within the first week after delivery. And the symptoms are severe and may include like feeling confused and lost, having obsessive thoughts about the baby, hallucinating, and having delusions. And they may feel like people are out to take the baby away or harm the baby, and they'll protect the baby. And they may have certain delusions like they're going to kill the baby, and or eat the baby, things like that. And when nurses are coming to just take care of the baby, and or loved ones are coming to just kiss the baby or something like that, they may think like differently, and they immediately try to take the baby away. And they are very conflicted and things like that also. And obviously having sleep problems is one of the things, sometimes because of insomnia. If somebody's sleep deprived for so many days and hours, that can also lead to having psychotic symptoms. So medications can be given to help them fall asleep and kind of feel more normal sooner. But other than that, obviously a psychiatric consult will be called from the medical team, and then we try to assess for safety of the mom, the child, everybody, and look for the symptoms pertaining to postpartum depression. So so again, having too much energy and feeling upset is another symptom. Feeling paranoid, like I said, because of the delusions, those kind of things are possible. And making attempts to harm themselves or the baby is also possible, right? And so those are just the basic things. It's kind of easy to diagnose if there's a cluster of those symptoms, and then basically if it's severe enough, obviously hospitalization is the way to go. Otherwise, if the father and the family is taking care of the baby, sometimes the mom with such symptoms are sometimes discharged home, because sometimes the mom is not having a thought to hurt the baby, but they may be just like severely depressed and not wanting to really take care of the baby and things like that. And for those reasons, you still want to start a treatment with, serotonin or selective serotonin reuptake inhibitor, SSRI, which are antidepressants. And also, sometimes if they're already, going through depression and things like that, and even with the medication, they weren't really benefiting much. And sometimes these depressive symptoms have been there, that the doctor usually right before delivery in the third trimester, their psychiatrist or OBGYN doctor will want them to start the antidepressant just to avoid the postpartum depression. Sometimes it's because it's a known history where the patient has had a postpartum episode before. So this may be the second delivery that they're going through, and they may be told to kind of take the medication beforehand and to avoid it. And if it's not working, and if they're like otherwise, too lethargic and not really having any energy, and we want to give them, a different medication, like in the SNRI family, it works on the serotonin and norepinephrine. So S and N stands for those. the two receptors, and then the reuptake inhibition is what the mechanism is to kind of treat these things. So basically, we are kind of having the mom's serotonin kind of be raised again, and norepinephrine levels be raised again through medication. Now, when we talk about this, obviously there's a bigger component to this, the proper nutrition, right? A lot of times there, yes, prenatal care is there. There are prenatal vitamins, but also a good diet is needed. So those prenatal vitamins and things like that, and then poor diet is what we see in some inner city, pregnancies and things like that. But proper nutrition is something also the mom would need to do, especially if there's postpartum depression and all that, just to replenish their serotonin levels and the different neurotransmitters, and provide a healthy environment going forward for themselves. And also, what if they're going to breastfeed the baby, they're going to deplete themselves and the baby with the proper nutrition. So you're going to have to advise proper nutrition also on top of these. So there are medications given even during breastfeeding time that's considered safe, and because there are certain medications that they don't cross the breast milk cross over into the breast milk too much, but there is some crossover, and then there are medications that cross too much. So we try to prescribe ones that are not so harmful for the baby in that sense, who will be breastfeeding and also getting a dose of the medication in that sense. And then there are new medications like brexanolone that's also being it was experimental for a while, but it's being used now, and it works to kind of normalize some of the hormonal imbalances and such, to also help correct their mood. So it is an endogenous neuroactive steroid that modulates neuronal excitability. Some people won't like it when they hear what type of medication it is, because it's a steroid, and if they want to feed the baby and things like that, does it cross over? They have a lot of concerns. So some people don't go for this medication. But again, it's a new medication that's out that has been showing some good results. So anyway, so that's basically a little summary of postpartum depression and the treatment. Any questions about this before we move to the next gear and the next topic?
So has the study shown how it impacts the baby who's gotten a little bit from the breast milk, say in different ages as they get older, or it's too new to know if there's even any impact?
Yeah, it's too new to know for the new medication, brexanolone, but with the SSRI, there have been studies, and usually there's very minimal, impact on the baby when they get it through the breast milk, but it's very minimal what they get when the right medication is provided to the mother. So Zoloft is like the one that crosses the least. So Zoloft and Celexa citalopram, those are the two that usually people kind of go for. And then obviously most moms, they don't want any part of it going to the baby. So they'll, say, yes, I refuse to breastfeed. If I have to take the meds, I'll give the, baby bottle feeding. They switch like that. Mm-hmm.